Well, I think Donald was about to say he's going to solve it by repealing it and getting rid of the Affordable Care Act. And I'm going to fix it because I agree with you. Premiums have gotten too high, copays, deductibles, prescription drug costs, and I've laid out a series of actions that we can take to try to get those costs down. But here's what I don't want people to forget when we're talking about reining in the costs, which has to be the highest priority of the next president. When the Affordable Care Act passed, it wasn't just that 20 million people got insurance who didn't have it before, but that in and of itself was a good thing. I meet these people all the time, and they tell me what a difference having that insurance meant to them and their families. But everybody else, the 170 million of us who get health insurance through our employers, got big benefits. Number one, insurance companies can't deny you coverage because of a pre-existing condition. Number two, no lifetime limits, which is a big deal if you have serious health problems. Number three, women can't be charged more than men for our health insurance, which is the way it used to be before the Affordable Care Act. Number four, if you're under 26 and your parents have a policy, you can be on that policy until the age of 26, something that didn't happen before. So I want very much to save what works and is good about the Affordable Care Act. But we've got to get costs down. We've got to provide some additional help to small businesses so that they can afford to provide health insurance. But if we repeal it, as Donald has proposed, and start over again, all of those benefits I just mentioned are lost to everybody, not just people who get their health insurance on the exchange. And then we would have to start all over again. Right now, we are at 90% health insurance coverage. That's the highest we've ever been in our country.
Secretary Clinton,
so I want us to get to 100%, but get costs down and keep quality up.
Secretary Clinton, let me follow up with you. Your husband called Obamacare, quote, the craziest thing in the world, saying that small business owners are getting killed as premiums double, coverage is cut in half. Was he mistaken, or was his mistake simply telling the truth?
No, I mean, he clarified what he meant, and it's very clear. Look, we are in a situation in our country where if we were to start all over again, we might come up with a different system. But we have an employer-based system. That's where the vast majority of people get their health care. And the Affordable Care Act was meant to try to fill the gap between people who were too poor and couldn't put together any resources to afford health care, namely people on Medicaid. Obviously, Medicare, which is a single-payer system, which takes care of our elderly and does a great job doing it, by the way. And then all the people who were employed, but people who were working but didn't have the money to afford insurance and didn't have anybody, an employer or anybody else, to help them. That was the slot that the Obamacare approach was to take. And like I say, 20 million people now have health insurance. So if we just rip it up and throw it away, what Donald's not telling you is we just turn it back to the insurance companies the way it used to be. And that means the insurance companies get to do pretty much whatever they want, including saying, look, I'm sorry, you've got diabetes, you had cancer, your child has asthma.
Your time is up.
You may not be able to have insurance because you can't afford it. So let's fix what's broken about it, but let's not throw it away and give it all back to the insurance companies and the drug companies.
Let me follow up with you, Mr.
That's not going to work.
Mr. Trump, let me follow up on this.
I just wanted just one thing. First of all, Hillary, everything's broken about it, everything. Number two, Bernie Sanders said that Hillary Clinton has very bad judgment.